Thanks for joining us on AD4 News Hour. I am Lilian Ogazi. Nigeria joins the rest of the world to celebrate World Food Day with the theme Our Actions Are Our Future, Healthy Diets for a Zero Hunger World. The World Food Day is designed in honor of the specialized United Nations agency, the Food and Agriculture Organization, founded on 16 October 1945. It is charged with leading international efforts to defeat hunger in developed as well as developing countries. AD4 TVRadio had an exclusive interview with nurse Halia Hales, during which she shared helpful tips on food consumption for healthy living.
World Food Day is just a reminder for us to be cautious about our diet and the things that we eat and how we manage our health through nutrition, which is actually very important, a very vital part of the health system. So it's a reminder to get our diets right in improving our health as a whole. Yeah, I think Abuja residents are quite civilized. So they follow the proper nutrition process. I mean, they're quite enlightened on the kind of things they should eat. Though some parts of Abuja, especially the suburb areas, they might not have the knowledge the Abuja Central or Abuja Town has. But yeah, I think Abuja is doing well on the nutrition part. Malnutrition is the absence of one or two food nutrients, while obesity is the over accumulation of fat in the body due to lack of proper planning of meals. But when we're talking about malnutrition and poverty, we need to understand that we have some natural materials, natural food that we grow ourselves in Nigeria, which is not a yardstick for saying, okay, there's no adequate food supply in Nigeria. No, we have all the classes of food to curb malnutrition. So now, the balance between malnutrition and obesity is knowing when and how to mix up the food ingredients we have available, because Nigeria is blessed with a lot of natural resources, which food is one of them. So balancing this thing is knowing when to inculcate vegetables and less fat materials or less sugary stuff in your diet. So if you talking about obesity, is knowing when to reduce your fat intake, knowing when to reduce your processed food, canned food, and things that are not natural, especially food that are not natural. Fertile lifestyle, when it talks about the reproductive system of both male and female in general, I'm going to just generalize it. Okay, in consumption of food, it goes ways in our body system, so that if you're consuming, let's say, a fat-based diet all the time, it's harmful to the body, we know, and which can make increase in infertility. Yeah. So the point here is that anybody that wants to be fertile, for a fertile lifestyle, healthy lifestyle, you reduce your carb intake, you increase antioxidant food in your diet, which includes nuts, fruits, and this contains a lot of vitamin C and E respectively. So these are one of the things you should put in your food menu. Then another thing is to reduce oil-based diet. I emphasize this thing a lot when we do health talks about the foods we consume. Unprocessed oils, fatty foods, and margarines and stuff, they are harmful to us in excessive way if you consume it excessively. So knowing when to strike a balance between this thing, it's not like you won't consume oil-based diet or not or something, but you have to reduce it to the lowest. You encourage things like fruits, you take a lot of rest, because if you eat a lot, no matter what you eat, and your hormones, your stress hormones are always high, no matter what you eat, it will not tell on your skin, it will not help your body, because you're not maintaining a healthy thinking, which involves your mental stability. Then another thing is exercise. We tend to focus more on food, multivitamins and stuff, but our ways of life can improve our fertility, can improve our health. If you go out, take a walk, take a jog, sedentary lifestyle has proven to be one of the causes of obesity, heart failures, infertility. When you have a lot of fat in the body, it is really harmful to the body, increases your insulin level, which can reduce your infertility and stuff. So then you should try to consume less refined food.
Similarly, World Food Day is celebrated annually on October 16th across the globe to honor the establishment of food and agricultural organization. This day creates awareness globally for those who suffer from hunger and to ensure the need for food security and nutritious diet for all. The main focus of the day is food as a basic and fundamental human right. In this report, our correspondent Nonso Arinzechi examines the level of food security in Nigeria.
The United Nations body noted that people around the world were either suffering from obesity or food insecurity. Over 820 million people, approximately 1 in 9 people around the world, are hungry, and malnutrition affected 1 in every 3 people. On the other hand, many people globally are suffering from food insecurity, a situation in which people lack secure access to sufficient amount of safe and nutritious food for normal growth and development, an active and healthy life. As Nigeria joins the world to mark the World Food Day, we went to the street to hear from Nigerians on their opinion on whether Nigeria has done enough in terms of food security.
Because relatively we haven't really been able to utilize all the potentials in that very sector of agriculture to see how we can make food readily available and also cheaper to the main man on the street.
Well, basically, I've heard stories about food security, about enlarging or increasing the food security in Nigeria in terms of rice and other agricultural produce. But I seriously don't know. Maybe these top government functionaries just fabricate such figures and all of that, because we Nigerians are not really feeling it.
Actually, the issue of food in Nigeria, we are in trouble. I have to be candid with you. This democracy is that we're supposed to be enjoying food issues very well.
They concluded by advising the government on what to be done to improve food production in the country.
My only advice is that the government should try to see how they can reform the sector, in what area, in form of trying to see how they can probably support farmers. Like, I love what the other former administration was doing. They had incentives that they were given to farmers to see how they can aid their production. At the same time, I noticed that for them to see how they can make food sufficiency in Nigeria to be something that won't be issue we need to sit down and talk about, is that they should try and see how they can put in more, like make a budget for the agricultural sector to see how they can help them in providing them that good amenities like roads. Because I noticed that one of the plight of farmers is that most times when they farm, to get this produce out of their farm down to the marketplace is always a problem. So
okay. My advice is that all these Anqua, Bora, whatever they are saying, they are boring farmers. If federal government to be sincere, you understand? We don't have enough tractor. Not enough tractor.
People globally should eat healthy diets for zero hunger world. Shifting to a healthier diet by eating more of seasonal fruits and vegetables and reducing the consumption of junk food could help in meeting the zero hunger goal of the United Nations. To make a change, all key stakeholders needed to join hands and make the shift. At the farm level, more seasonal, indigenous crops needed to be cultivated to meet nutritional needs. Private industries need to produce products with less sugar, salt, and fat, and fighting food insecurity reduce wastage of the product. Nonso Arinzechi, AD4 TVRadio, Abuja.
The Federal Polytechnic in Nasarawa State, Nigeria, has expelled 66 students over their alleged involvement in examination malpractice and misconduct. The rector of the Polytechnic, Abdullahi Hassan, stated this in a statement issued on Wednesday. He said the measures was meant to promote discipline and ensure quality and standard of education in the Polytechnic. Abdullahi explained that the students, who were both regular and part-time, were expelled on the recommendation and approval of the academic board of the institution. Abdullahi assured that his administration would not rest on its oars until examination malpractice and other corrupt practices were eliminated in the institution. Moving away from that, the Nigerian Air Force on Wednesday began free treatment of 90,000 persons under a 3-day medical outreach at Gomari area of Maiduguri in Borno State, Nigeria. Chief of Air Staff Air Marshal Sadiq Abubakar made the disclosure at the inauguration of the exercise in Maiduguri. Abubakar, represented by Wing Commander Amadi, the Air Task Force Commander Operation Lafia Dole, said the exercise was designed as part of its humanitarian intervention and corporate social responsibility to host communities. He said that the exercise was aimed at improving healthcare service delivery and well-being of persons affected by conflict and host communities, as well as foster civil-military relations. Abubakar explained that the diagnosis, consultancy, dental, eye, and general surgeries will be conducted free in the exercise. The Nigerian Center for Disease Control says it is increasing the number of laboratories to enhance capacity for response to outbreak of infectious diseases. Its Director General Chikwe Ihekwezu disclosed this in an interview with newsmen on Tuesday in Abuja. Ihekwezu said laboratory information is critical for infectious disease surveillance and its control. The Nigerian Center for Disease Control Board said laboratory information must be accurate, timely, and subjected to quality assurance procedures for response to outbreak. He said that the center had continued to work closely with stakeholders towards improving knowledge on infectious disease through research activities and epidemiological studies. The Minister of Health, Osage Enaire, has said that oncological services are very expensive in Nigeria due to the stage of diagnosis involved in confirming cancer disease. Enaire said this at the annual National Health Dialogue in Abuja on Tuesday. He regrets that majority of cases were diagnosed in the late stages, saying that early detection of cancer could greatly increase the chances of successful treatment. The minister, who was one of the panelists during the discussion on cancer control in Nigeria, sustainable strategies from primary health care to tertiary referral centers. The dialogue was an opportunity for Nigerians to rub minds on the growing health system in the country. He expressed concerns about the high prevalence of cancer, hinting that the government would continue to explore ways of working around to increase support to cancer patients. You're on to AD4 News this hour. We're going on a quick break. More stories on our return. You're welcome back. An eye specialist, Adekunle Hassan, has called for the adoption of new model primary, secondary and tertiary healthcare network to change methods of healthcare delivery in Nigeria. Hassan, also the Chief Executive Officer, Eye Foundation Hospital Group, made the call on Wednesday at the 16th Horatio Orisijolomi Thomas and 57th Founders Day Lecture in Lagos. It was organized by the College of Medicine, University of Lagos, Idi Araba, Lagos. Hassan said that adoption of new model schools would change the method of healthcare delivery system. He said that teaching institutions should create their own primary healthcare centers and man them with experienced senior resident doctors and nurses in training. A Lagos-based NGO, Vision Foundation, has said that the nation's health and education sector required emergency attention for the sake of the less privileged and the vulnerable in the society. Chief Bolanle Akinyemi, a member of the Board of Trustees of the NGO, made the appeal in Lagos State, Nigeria on Wednesday. He said that a huge gap in the health sector had also made many of the less privileged people to resort to the use of herbs. Akinyemi said that the NGO had provided free treatment for many residents of the state, especially the vulnerable living in the slums. Still on health, the Kwara State Governor, North Central Nigeria, Governor Abdulrahman Abdulrasak, says the administration is fully committed to the development of the health facilities for effective healthcare delivery to people in the state. Abdulrazak made the commitment on Wednesday at the inauguration of Okeibala Leprosy Settlement in Omuara, Irepodu local government area of Kwara State, Nigeria. Represented at the inauguration, Wale Suleiman, his special advisor on health, said health is paramount and must not be taken with levity. The governor urged well-meaning individuals and corporate organizations to assist the state government in its efforts to make life worth living for people. He said the state government could not afford to rely on the international community to do everything for the people. The managing director of the International Monetary Fund, Kristalina Georgieva, has urged women around the world not to accept lower wage in the workplace. She disclosed this while recounting her experience in her earlier career during the Soviet era, saying she did not know at that time she could bargain for better conditions. She called on women to take on far more unpaid work than men, but never to take a lower wage in the workplace. According to reports carried out by the International Monetary Fund, women do 2 hours more of unpaid work than men every day. While urging women to be more competent and confident, she says there is urgent need for gender equality in the workplace. A development in agricultural economics, University of Abuja, Park EDC, says intense rainfall and floods can affect farm produce. According to him, intense rainfall can affect the growth of farm produce such as rice, beans, and guinea corn, as they do not require much rain that Nigeria is currently experiencing. He said the current rainfall being experienced in Nigeria could be seen as the effect of climate change, adding that the rains had continued to intensify instead of abating. According to EDC, Nigeria is not food sufficient due to lack of warehouse for food storage, adding that the current high cost of food prices is due to lack of food reserve. He urged the federal government to adopt massive food production, develop storage facilities for grains and food processing facility for all year round, adding that these would enable Nigeria to be food sufficient. Sheep and Goat Farmers Association of Nigeria has appealed to the federal government of Nigeria to provide artificial insemination technology for its members to enable them boost quality animal production. The Shigo Fan National President Alhaji Wahabi Salami made the appeal in an interview with newsmen on Wednesday in Ibadan. Artificial insemination is commonly used instead of natural mating in many species of animal because of its benefits. Salami said artificial insemination technology would help in quick production and multiplication of quality animals. He also urged the government to provide dairy farms in different local governments in the country where milk could be produced for the benefit of the people. And that's it on the news. You can join the conversation on our website at www.AD4TVRadio.com. Like and subscribe to our YouTube channel at AD4 TV Radio. Follow us on our social media handles at AD4 TV Radio on Twitter, LinkedIn, Instagram, and Facebook. Many thanks for watching. I am Lilian Ogazi.